Good evening, everybody, and welcome to this interactive session. It's a seminar organized by the Health and Well team in collaboration with myself, Dr. Drugs. We're trying to see how we can help our mothers that are battling, because it's actually a battle, with this intellectual disability called autism. So we're going to run through what we're going to talk about briefly, but I believe in a very short while, say 30 minutes, we should be through, as we're mostly going to concentrate on the kind of things that we need with regards to this, regards to alleviation or solving this or demystifying the processes in the management of this ailment of this intellectual disability. Now, yes, so today we're talking about autism management via improved neural connections. I want us to understand, before we continue, that our brain is just like a flash drive, and it's also like a ball of nerves floating in fat. That's just a very lay and crude definition. The way these nerves interact with each other determine how the brain can actually adapt, learn, accommodate, and so on, information, and also in the environment as well. So I remember my humble self, Dr. Drugs, as aforementioned, and once again I say good evening and I thank you for your patience, and prepare your questions after this so that we can answer them, and whatever it is from any aspect. There are so many mysteries that surround, mysteries in quotes, that surround autism, but by the grace of God, He will give us the wisdom to be able to demystify these things and make it easier for us to understand. So we'll be talking about autism, basically, and then we'll talk about the risk factors, and then we will now delve into management. Then we'll see that management is mostly divided into two aspects. Then we'll select one part of the first aspect, and then we'll go into the other aspect, which is what we're actually talking about today. Well, we may flash through Down syndrome, cerebral palsy, and dyslexia just briefly so that people can just have a glance at what they look like. Management of autism via improved neural connectivity. This is where we are coming to. And we'll see how important this thing is. It's quite technical, but I'm going to break it down in such a way that we'll be able to understand easily without much ado, in simple terms. And if there's anything I say that you're not clear with, kindly ask at the end of the seminar. So, autism spectrum disease, as we know before, as we've mentioned before, described before now, is basically a neurological and developmental disorder that affects what? Communication, social interaction, and behavior, period. So, it's regarded as a spectrum disorder. That means that different parts of it may display in different degrees in different people. Basically, yes, last time I actually explained to us how every single person you know has autism, but to a certain degree. It all depends on how it manifests itself in the individual, and it depends on how the individual responds to stressors. It depends on how the society accepts behavioral norms and a lot of other factors that determine whether one can be termed to be autistic or not. I also made us understand that stressors like alcoholism, stressors like anger, and so on and so forth can actually precipitate or bring out those autistic tendencies that are hidden within each and every person that we know. So, in a nutshell, we agreed unanimously that it should not be cured, but the people that have autism should not be cured, but they should be accommodated with love in the society, because everybody has it to one extent or the other. Even if someone has 0.0001 over 5, the person has it. Maybe what precipitates that person's, shows that spectrum in that person may be hunger or anger or anxiety or emotional breakdown and stuff like that. So these are the things that we're looking at. So we talked about the brief type, we talked about the types briefly. We have three major types: the classic autism, Asperger's syndrome, and the much milder form, which is the pervasive developmental disorder. Then we talked about the signs, which include difficulty with social interaction, verbal and non-verbal communication issues, perseverative interest, that is being persistent or rigid on either a particular response, such as a word, phrase, or gesture, that they don't want to stop reciting the same thing over and over again, or doing the same thing over and over again, and they throw tantrums when they are, pulled out of it. Stereotypic body movements, rigid routines, as I just mentioned, and other factors as well. So the complications range from educational or learning issues all the way down to bullying. These are the risk factors. We talked about older parents being older before giving birth, being a risk factor, setting prescribed drugs. Of course, we know that chemicals are mostly contraindicated in autism. That's what people don't even know. And then we talked about the things that happen before pregnancy in a woman's life, like a woman that smoked and drank heavily, and underwent a lot of stress, and that can actually predispose a child to things like this. Things that happen during the pregnancy and things that happen after birth, even during birth as well, can also cause it. Because if a child is starved of oxygen during birth, so if oxygen supply to the brain is cut short for a longer period, like difficult delivery, delayed delivery could actually cause this. A small birth weight, poor brain development, being a boy is a high risk factor. That's being a male. Genetics, that means if the father or mother had it, there's a high tendency that there's a higher tendency the child will have it. Preterm birth means the child being born before the normal 9 months. Yeah. Then malnourishment, like women not taking enough things that contain folic acid, vitamin D, essential fatty acids, EPA. We'll talk about that extensively shortly. We talked about mothers being the first doctors after God. And this is where we are warming up before we're going to delve deeper into what we're talking about. We talked about the risk factors. So when I mentioned something like avoid the risk factors, we have an idea of what they are. Now, management, these are the various activities and processes used to mitigate, prevent, or reverse the progression of this intellectual disorder or disability. But of note is that the mother is the first doctor after God. The best way to combat autism is to educate mothers. That is what I believe. Because the first interactions these children have, the first speech therapy, the first occupational therapy, the first every cognitive behavioral therapy, everything starts from the mother. All things being equal. So mothers they are more important than health practitioners. So educating mothers is key in management of this condition. But unfortunately, not every mother knows the importance of this. Some mothers are even ashamed to even join a Zoom seminar in regards to autism, not knowing that the older the child gets, certain things happen in the brain. I'm going to explain further, and you will see how important it is that this is addressed even now. Now, improved neural connections is very important. We are going to go there as well. And two, it's too important to be ignored, as improved brain activity comes with it. You understand? Without improved neural connections, all other activities and therapies are not so useful. I'll explain why this statement I made. It may sound strange, but it's funny, but it is true. You and I will assess this ourselves. So management, apart from the use of chemical drugs, which of course lead to other issues like weight gain and other side effects, and avoiding risk factors, entails early management via applied behavioral therapy, cognitive behavioral therapy, especially when the child is having ADHD, which is the cousin of autism. Both anxiety, depression, and all that. Avoid chemical substances in food, cream, soaps, insecticide, perfumes, occupational therapy, speech and language therapy, dieting, of course, long-term gluten and casein-free diet. That's what affect all these things that are in wheat, indomie, spaghetti, and all those stuff. Milk and other dairy products should also be restricted. In fact, highly restricted, because it has been proven that when they are taken off from a child's diet for about 2 to 4 years, it also helps a lot with regards to the reversal of this condition, or this intellectual disability. Now, use of natural pharmaceuticals to help to mitigate the comorbidities. I call these comorbidities the Ashebi of the problem. That's the bridal train of the problem. Autism being the bride, we cannot attack autism, but we can actually attack the bridal train and, give the child the opportunity to have a more normal life. These are a few of the comorbidities: epilepsy, learning disability, anxiety disorder, depression, and sensory processing disorder, and their respective percentages of level of degree of occurrence is also there. That's just an estimate, as you can see. Of course, weak bones as a result of avoiding casein, which is milk and dairy products, also predisposes the child to weak bones, because you know that we have a lot of vitamin D and calcium in milk. You understand? So that's so just a few tips before we delve into our matter. We talked about all this before. We need to avoid, as aforementioned, casein in dairy products, gluten in those ones, monosodium glutamate, Maggi, no, Ajinomoto, all those things contraindicated in autism. And you find out that these things, and nobody's going to make a product and begin to advertise the good things about the product and begin to advertise the negative impact. Nobody will buy it. If they write contraindicated in ADHD and autism in children, who will buy Indomie again? You understand? So we have to use or apply wisdom. Refined sugars like soft drinks, table sugar, pasta, flour, these things. These things are not, nobody's going to tell you that you should not give your child Coke, Fanta, Sprite, and all these things that have to do, especially when they are within this spectra. They're not supposed to be taking these things because of the ADHD that is attached to it. You understand? Nobody's going to tell you. You have to be wise. And that's why educating mothers is very, very important, because I don't want to talk about the government, but nobody's going to help you except you help yourself, except God too. So that's just it. That's why our lectures are very important. These are just a few things, just a summary. Avoid pesticides, air pollution, heavy metals, phthalates, polycyclic aromatic hydrocarbons, like the ones that come out of the exhaust of cars. Imagine people smoking in front of children, or mothers smoking themselves. They can smoke a child into autism and ADHD, and you can see that as well. You can see this non-stick cookware is also it's also contraindicated. You can see these things in the plastics and canned food linings. You see, and we have volatile organic compounds as well, like the ones found in paints. People don't even know that when they're painting a house and the woman is pregnant, you don't go there. People don't even know. Cleaning products, people don't know about that. Building materials during pregnancy and early childhood should be avoided as much as possible, because they can actually predispose the child or provoke autism. You see these parabens in the cosmetic world, phthalates and the fragrances, nail polish. They're going to paint their nails, and they're painting autism into children. You can see bisphenol is here again. It's a terrible compound with regards to autism. Triclosan is so common. All the toothpaste that people keep advertising, you see advertising with millions of dollars and all that, but nobody's going to mention that this triclosan actually provokes autism. You understand? One way it affects children that have autism, and you find it in toothpaste, antiseptics, antiseptic soap, and all these things. Xyloxane, toluene, also found in nail polish and hair dyes. You see, ladies these days, everybody wants to be like these footballers. They paint their hair. The center up here will be white, the side will be dark, the draw lines, and all those things are not good with regards to autism. You can see that. You can see the formaldehyde releasing agents, hair, just a lot of things that have to do with what women use to make themselves beautiful are seriously contraindicated in autism. Synthetic fragrances, aluminium deodorants, those things, the ones they spray under the armpit. Apart from the fact that they can lead to breast cancer, which none of them will tell you. Nobody will make such products and mention that the tail of the woman's breast extends under the armpit. And when you are spraying those things in there, you are actually spraying your breast technically, and that can actually lead to breast cancer. People don't even know. So we have other things that women can use. This is a quaternium 15 and all that, parabens, phthalates, and all. These are things we discussed the last time. Just to run through And we also talked about witchcraft not being part of the things that cause autism. So people take their children to beside the river to go and flog with broom. So we carry to a native doctor that will be massaging. I don't know whether they want to massage autism out of the child. I don't know. So we flog the child so badly, and the child will be shouting, and they'll be saying the autism is living, it's a demon, it's a spirit, not knowing that the child is in pains because the child is hypersensitive. That is why you see that they respond differently to stimulus like lights, sound, and all that. You can be shouting at an autistic child, and you see the child just covers his ear and starts yelling and shouting because it's just reciprocating what he is receiving. You understand? So we have to take it easy. And it's not caused by witchcraft. So nothing like that. It was one woman in the village. Epsom salt, I've talked about how it promotes ADHD, and people should stop giving their children Epsom salt to drink. Even if you put it in bath water, if it's recommended by your health, should have very little. You understand? Should be used, or you just use water gently and put the child will be calm. Vaccines don't cause autism. Autistic people have emotions. Populating does not cause autism. You say, this child is behaving like something. No. The mother did not train the child well. It doesn't work with autism. Technology, I spoke about how people can use the iPads and the TVs to help these children to develop. I've heard rumors of people saying that these iPads and these TVs what's the thing they said, that they are contraindicated in autism. I'm like, who said so? The child won't listen to the teacher. The child won't listen to the parents. The child won't listen to the friends. The child won't listen to the mother. And the only thing the child is listening to is that iPad. I suggest you humbly take that iPad and inculcate the things that you want that child to learn inside them. You'll be shocked as the child is singing the nursery rhymes or listening to the nursery rhymes in the iPad is also helping to improve neural connectivity. It's not about improving neural connectivity because the brain cannot imbibe new information or learn without improved neural connectivity. We'll talk about that shortly. So this is how natural pharmaceuticals help. Essential fatty acids are provided. Neurotransmitters are provided, nerve function and response improved, gastrointestinal issues diminished, brain is relaxed against insomnia, bone integrity is also preserved, then improved nerve function technically, and general renovation and rejuvenation and regeneration of the body as well. So you can see this is how we are going. So beautiful. Now we are here. So talking about management via improved neural connectivity. That's where we are coming to. If I remember, that was the first thing we said we're going to talk about. Now, the human brain is malleable, adaptable, changeable. And this is how the brain learns and stores information. If the nerve connections do not interact with each other and improve or do their thing, you can't learn anything. But the rate of this changeability, I just coined, it's not a real word though, I just coined that one, is inversely proportional to age. That means the older people get, the slower the brain adapts to changes. You understand? Now, hence, generally, the earlier the required changes are made in a child, the better. So in relation to intellectual disabilities like autism, this simply means that the brain is easier to reform when the child is younger. In short, the earlier, the better. That's why you see that children that maybe have begun to receive treatment or management when they were 1.5 years old, in about 2 years. So the earlier these neural connections are taken advantage of, the better for children that have autism. That's why the older the child gets with this condition, the more difficult it is for the child to change. You see that the child can be 10, 11 years still wearing Pampers because, unfortunately, the opportunity for the child to have learned how to be potty trained has gone. And now the brain is slow to adapting. You see the child every time does not know when to poo. You tell the child today, tomorrow he has forgotten because the brain cannot absorb anything new because of the poor neural connectivity. So the question is this: how does the brain change? How does the brain improve? And how do we learn via these improvements or changes that take place in the brain? So the brain changes or learns or adapts it is via improved neural connectivity, as aforementioned. And this can be achieved either through experience. You understand? That's why if I come to your house to come and visit you, and then you offer me something to eat. I say I don't want to eat. Then you come to my house on that day and I offer you. You say, Shebi, you came to my house that day and you did not eat my own. Me, I'm not eating your own today because your brain has taken record of what happened. You understand? Those nerves have reconnected themselves in such a way that they have stored that information that Lagbaja did not eat in Taiwo's house. And so Taiwo will say he's not going to eat in Lagbaja's house because the brain has actually, but the problem now is that we'll see what the problem is with regards to this. I don't want us to just go too fast. So you can see a typical example of how this is, achieved is applied behavioral analysis, popularly known as ABA. Then nourishment, supplying the necessary materials needed for the brain to transform, improve, and or support neural connectivity directly or indirectly. This is super important because if the cells do not have materials to grow and reconnect and reform, it's a complete waste of time. Just briefly, applied behavioral analysis is a scientific approach to understanding and changing behavior. It involves the use of techniques based on the principles of behavioral analysis to increase desired behaviors and diminish problematic or problem behaviors. ABA is often used in the treatment of autism spectrum disorder as well as other developmental disabilities and mental health conditions. So you and I, we all know that the first people that that apply this behavioral analysis on us are who? Our mothers. Don't do this, don't do that. Greet that uncle, say good morning, say good afternoon, say how are you doing? Say I'm fine. You understand? If you do this, I won't give you ice cream. If you do that, I will give. See, our mothers are the first. And that's why it's very important that we are doing this right now. As you can see in the picture over there. So these are just let me just call it like, I say 10 commandments of how ABA is, functional analysis, goal setting, assessment, intervention, evaluation, positive reinforcement, prompting, training, shaping, extinction, and consider. And let's just delve into nourishment. This is where we are coming to. You see, this is the most important part, as any effort to learn new things via professional therapies may not be too useful, as this can only be achieved via brain or nerve structural and or collective modifications. So it's like trying to pour water inside a basket or trying to load up an already full flash drive. Nothing can enter. So that's why some people are frustrated because the brain it is where the child's brain, the way it was when it was 1 year, when he was 1 year old, is still close to that when the child is 3 years old. So how do you expect something to enter? And that's why it's good that we supply the brain what it needs to reform itself. And hence, we will appreciate this, our meeting, much, much better shortly. So certain materials are needed directly or indirectly to assist with structural modifications. Note that mostly natural substances are truly useful in this regard. Chemicals, I don't know. It's so difficult for people to understand that chemicals just help. They are shortcuts just to take the child out of danger. The child is epileptic, you give the child 1 or 2 anticonvulsants and all that. But these anticonvulsants also have their side effects. And one of their side effects too is autism, in quotes. So it's a serious problem. That's why these things are difficult to tackle. But guess what? When you use natural pharmaceuticals and natural substances, these children respond better. And they have less tendency to have side effects. That's what people do not understand. So when you're waiting for one professor, you say you're booking an appointment, if after 6 months he has not had your time, you're wasting your time. There's some basic things that we need to understand that even the professor cannot do for you. The professor cannot prevent you from applying a cream that contains sodium benzoate on your child. The professor will not help you when you do not know that sugar and Coca-Cola and Fanta and all these things are contraindicated. So can't help you with that. It can help you to interpret a CT scan. It can help you with a lot of things, or diagnose that the child has autism, or try 1 or 2 things. But the majority of the job lies on us, especially the mothers. That's why this will soon be true. So let's start with EPA and DHA. A lot of people, you see them, they're buying EPA. You see a packet will be so massive. You just write DHA. They will say, wow, this DHA they wrote here must mean that there's a lot in there. Scam. Many of them are empty. People are just drinking groundnut oil and other things that nobody knows about. If you want to know whether the DHA and EPA in a capsule are authentic, take styrofoam, burst the capsule, 2 of them in a glass cup. The oil will float to the top, right? You take the styrofoam and drop in that oil, leave it there for some time. If it dissolves it, it is original, most likely. But if it doesn't, you have been giving your child groundnut oil to drink. These are secrets that people do not know about, and it's affecting these children. When they say, what I'm giving the child DHA, and we are giving the child nonsense. Maybe we don't even know the kind of oil the child is drinking, because people are desperate these days. So one has to be careful. So that's one thing we've learned this evening. Now, how does eicosapentaenoic acid and docosahexaenoic acid help us? These are omega-3 fatty acids that help against autism in the following ways. They improve sleep patterns. They help with early awakenings and difficulties falling asleep. You know that some children wake up 3 a.m. every day and start shouting. They improve cognitive function that by help improving concentration and memory skills. That's one of the greatest issues that autistic patients have. Reduce hyperactivity and tantrums. Improve social functioning. Eye contact. That's one of the ways you know a child that is having problems. Anything I'm telling you, just know I'm telling you from experience. When you're talking to your child, the child can't look at you in the eyes. Can't stand in one place. We are holding him here, he's moving there. ADHD and all. They reduce inflammation, which is often associated with autism, because the brain is often inflamed. And then they improve listening and concentration skills. These are the things that EPA and DHA does. The real deal, not those ones people are buying up and down. I don't know. I'll show us an example of what I use for my own patients, and it's working wonderfully well. Yes, they're expensive, but what is as valuable as a child's future? Remember that our children's future are virtually our future, because when we are done with all what we are doing, they are the ones that take over. So if you refuse to invest in your children because you are trying to save money, you are refusing to invest in yourself. Then they reduce dyslexia and violent behavior. You know that when they throw tantrums, sometimes if you're not careful, you can receive 1 or 2 punches and all that. And they improve mood swings and reduce depression. Now there's another molecule called choline. I can bet you that most people here have never heard this word before. It's a neurotransmitter precursor, and it is abundant all over the body. The neurotransmitter is acetylcholine. There are 2 major axes one is called the parasympathetic, the other is called the sympathetic axis. And choline is highly, highly important in the parasympathetic axis, the part that helps with digestion and relaxation and all that. Whereas adrenaline, on the other hand, is very important in the sympathetic axis, the one that has to do with the flight or fright. That's what people are angry. That sympathetic axis is brought out. Then when people are relaxed after eating, they're just leaning back on their chairs and they want to just have a nap, the parasympathetic axis, that is the axis that we need more in these children. That's why choline is very important. I try to explain these things practically so that we can understand that this is a neurotransmitter precursor that helps the body to relax. And mind you, because the brain is found abundantly in the gaps between nerves, and guess what? The brain is virtually a ball of nerves floating in fat. So you can see how important this is in the brain. It helps with memory and cognitive function. You know that one of the challenges is that autistic children cannot continue conversation. Do you like mango? You say mango. Are you coming? You say coming. Put on the TV. TV cannot say, do you like mango? What type of mango is it? Oh, they can't engage in that kind of conversation because they have memory and cognitive function issues. Then this choline also helps to reduce anxiety, as I mentioned, and they help to improve social interaction and even reduce that thing that makes the child rigid or perseverative. That's the child is like repeating a phrase, I love my mommy, You can say it up to 2,000 times. That is perseverance index. And it is also part of the symptoms of children that are autistic. This can also help to reduce that. So let's just see another molecule here. We have 1,2,5-dihydrocholecalciferol. That's what we call vitamin D. Who knew that vitamin D could do all these things for children that have autism? People don't even know. Look at it here. Anything you see here, just go and browse, go and verify it. You understand? You can see that it's crucial for what? Brain development. Remember that sometimes we tell mothers in the morning, take the child under the sun. What do you think we're telling the mother to do? The skin produces vitamin D. That's why it's called sunshine vitamin. And it's so powerful that if a child does not have enough of it, he begins to have what they call a bow leg, in quotes, rickets. You understand? The child begins to have bow leg. And that shows you how important it is. Now look at it. Now, it's crucial for brain development, and a deficiency of it in early life can alter brain development. Can you imagine? And what is the origin of autism's problem? Brain development. And the deficiency of it in early life can alter neurotransmitter balance in the brain, decrease body and brain antioxidant ability. That is the ability of the brain's DNA, the cells of the brain, their DNA are protected by antioxidants because free radicals are neutralized by antioxidants. And they alter the immune system in ways that resemble pathological features commonly seen in autism spectrum disorder, ASD. You can see how important vitamin D is. Benefits of vitamin D for autistic children include bone health. Remember that casein-free diets, that they are short of milk and dairy products that contain vitamin D and calcium. And so you can see that it's very important. Brain development, as aforementioned, mood regulation, neurotransmission, and synaptic plasticity. Adaptability of the nerves, in short. That is just the layman's description of that. Neurotrophic and neuroprotective actions. That's the ability of the nerves to grow, neurotrophic, and also protecting the nerves from damage. We're talking about the nerves not being complete or not enough to bring a child out of autism. We don't need anything that is going to complicate issues at all. So we need something that will protect these nerves, the little ones that are there. You understand? So that's why vitamin D is also important. And they help in improvement of the core symptoms of autism in about 75% of autistic children. So that means about 75% of autistic children when they take the real deal. I'm talking of when they write vitamin D3, they write D3 as big as a trailer tire. D, they now write 3, at the end of the day, empty. I'm not talking about that. I'm talking about the real deal. The real things are more expensive than this. Go and check, you will see. And then they help to regulate about 3% out of the 26,000 genes in the coding of human genome. Imagine that's how important vitamin D is. And reduces the expected incidence of autism in mothers who already have one autistic child. You know, if a mother has one autistic child, the tendency of the mother having on that one is already high. So it brings it down to from 100% to 25%. This is not a wonderful molecule that people are taking for granted. Vitamin D. Then coenzyme Q10 that you see some grandparents drinking because of heart problem, because it helps to repair the heart. A heart that's already having cardiomyopathy can, with proper lifestyle changes and use of coenzyme Q10 and other adaptogenic substances, you can imagine that this heart can reform back. That is how powerful this molecule is if you use it rightly. But who knew that the powerhouse of the cells involved in energy production in cells that help to prevent fatigue, weakness, and all that are also supported by this coenzyme Q10. Antioxidant properties help to protect the DNA and neutralize free radicals that damage it. They help with improved communication. Have you ever heard this before? That means if you are giving your child this coenzyme Q10, the communication will improve. What people are spending millions for. They are doing speech therapy. They are doing all therapy in the universe, whereas the brain is still where it is looking at you. All those your therapies are just useless, mostly. Only at the pace with which the brain reforms will the child be able to learn anything. I stand to be corrected. If you have anybody that feels I'm saying I'm not correct, of course, we know that as you learn, your brain evolves. But when your brain does not have the material to evolve, it's a waste of time, mostly. And it also helps to improve that parent to child communication. And whereby you see mothers holding their babies and saying, say baba, say baba. That thing is so important. That's why our mothers are our first speech therapists. Those ones that we are paying tens of hundreds of thousands, they are just secondary. The primary speech therapist is going to give the secondary speech therapist money, which is good because they are professionals. Yes, and they know more what they are doing. But you should have started at home. Go and learn speech therapy to the best of your knowledge. At least when the child comes back from that special school, you continue at home. Wisdom indeed is profitable to direct. Better sleep patterns, insomnia, reduce food rejection, and helps in gastrointestinal issues. Just imagine. Then this aloe vera people have in their compound as decoration flower. Look at what it does for children that have autism. It helps in gut health. And in that when children have autism, they have the high tendency of having irritable bowel syndrome. Remember that the brain and the intestine are, from an embryological level, are related. There's even a brain-gut connection. Can you imagine? Who knew that your intestine and your brain are connected in one way that is identifiable by science? Immune support, antioxidant properties, nerve protection, behavioral improvement. What people are searching for, they don't even know that it is just right there beside them. It also helps with digestion, which is essential for brain function and development. You can see there, due to improved nutrient absorption. Inflammation reduction. Remember that the brain of autistic patients are often inflamed. I had an autistic patient and a child that had one spectrum before, couldn't speak well, say that he was having a headache. When he began to recover, imagine that this child has been having headaches since and nobody knew because the child couldn't. And when the child started talking, he said, my head is aching, pain. You understand? So imagine how long the child has been acting weird due to that severe headache as a result of the inflammation in the brain, and nobody, the children are suffering. Even the mothers too are suffering. Oxidative stress reduction, gut-brain axis support. Remember I mentioned that recently. Aloe vera helps support the gut-brain axis, which is essential for brain function, mood regulation, and overall health. You can see it's natural and safe. So aloe vera is natural and safe, which is essential for individuals with autism who may be sensitive to medication. In fact, so many children are sensitive to medication, not even maybe. They are solving one problem with these chemical drugs, they are bringing another from another side. That's the problem we're having there. Then it's a powerful somatic stem cell stimulant. These are the body's customized ministers for warps and repair. I mentioned the last time that anybody that tells you that you are drinking stem cell, give the person my number. Tell the person to call me and tell me how you can drink stem cell. Well, it may be available. I will learn. But I know that the acid in your stomach will destroy any stem cell. So it's useless. Or you say, I'm putting it under your tongue. It's going there and going into your blood. That's a scam. It's a lie. The barrier between your tongue and that drug is made of cells. So cells start passing through cells. The only cells that I know that can live inside cells are cells like Neisseria gonorrhea. They are intracellular cells. They live inside the cell. They can live inside the cell or something like that. Stands to be corrected. So how can stem cells pass through under your tongue? Say they open your tongue. Scam. The stem cells, the somatic stem cells are the cells. The stem cells we had are the ones that when we were developing us in the womb of our mothers, the one that forms into the heart, the organs, and the liver and other parts of the body, and differentiates us into what we are. When we become adults like this, those stem cells are only found in where the bone marrow and some other, maybe one or two other parts of the body. What we are left with are somatic stem cells. That's why when you have a cut, you see that in a short while it begins to cover, because the customized ministers for works and repair have gone there to start working. God is wonderful. Probiotics. You see, if not that Greek yogurt is from, a dairy source, we have lactobacillus acidophilus in there. But the child, because of the casein that everyone is trying to avoid, whether the casein in the Greek yogurt is minimized or not, we're trying to avoid dairy products completely. Hence, we need to take these probiotics separately. And just look at what they do for the child. Gut-brain connection, the link between the brain and the gut is crucial. Digestive health, for children that have irritable bowel syndrome, they reduce anxiety. Who knew that? Boost the immune system in these children, reduce inflammation, improve sleep, reduce behavioral problems, which is one of the key issues in autism. And the one that even made me myself, that I'm a scientist, when I studied this one, and that made me happy, is that they help to improve the ability to listen and concentrate, which is one of the greatest problems in autistic patients because of the causing ADHD. You see, many of us do not know these things. And that's why we keep wasting our time, waiting for, there was a parent I spoke with, and then they told me that they have been waiting for one professor for the last 2 or 3 months. The child is getting older. The tendency, the ability of the brain to reform is reducing, and you're waiting for a professor for 3 to 6 months. When you could have started by avoiding milk, avoiding wheat, avoiding excessive exposure to chemicals, petroleum jelly. You could have started from that one. Why are you waiting for your professor? Because you're waiting for your professor, you're still cooking Indomie every day for your child. You're waiting for professor. By the time the professor comes back from UK, and as he's landing in Nigeria, they invite him to Brazil, you'll be waiting for him. When you can be your own professor to a good extent and be helping that child until you have professional help. That is the reason why I have these seminars, to help mothers understand these things. There are a few examples of the products I use. I'm not saying that you should use them, but these are the ones I use because I don't have time for story. Autism is an emotional disease condition. Nothing like there's one man from one state like that is importing one thing from China. I don't have time for all those ones. This one has been here for about half a century. And I've used it to help it. At least I know one child I can mention that in 2 years can barely detect that autism in that child. Just 2 years. This one contains EP and DHA. This one contains choline we spoke about. This one contains 1,2,5-dihydrocholecalciferol and contains dicalcium malate. This contains carotenoids that are good for the brain, the eyes, the skin. This one is coenzyme Q10. In short, this is one of the most amazing products I've used for patients in my life. This product. This one contains those probiotics. Instead of you giving a child dairy products and risking the exposure to casein, you give this one. At least, even if you can economize, this can last 2 to 3 months. That's not finished. It's expensive, but it will last. Because these cells are alive. When they go in there, they start growing. That's why they're called probiotics. Probiotics. When they go there, they begin to function. This one even contains what is in here, but also contains more, and it doesn't finish easily. That's why I prefer giving patients this one rather than give this calcium. So this cardio health, active Pro B, kids, without being told, will know what this is for. Brain development in children, overall development in children. Fiber, as we all know, helps with digestion and release a lot of issues in the tummy. This product here, B12 Plus, contains cobalamin analog and folate analog, which are essential for regeneration and rejuvenation of the cells, of the nerve cells in the body. And you know that the brain is virtually a community of nerve cells living together inside fat. That's just, I keep saying that, just a layman description. This contains chamomile for mothers that are saying that child cannot sleep. A mother was giving a child Epsom salt, and the child was waking up early in the morning and spreading shit all over the house and even on her head. I almost, in my mind, I was crying. I have been crying a little when the woman was telling me, not knowing that Epsom salt causes diarrhea and causes ADHD. Nobody told her. Remember, we spoke about triclosan and all this sodium benzoate and all these things that are causing problems in children. Aluminium salts, like the ones that are found in the, I don't want to mention the names of these common ones that some women, when they are spraying this thing on their bodies, they nearly lift off from the floor like a rocket, like the pressure everywhere. I mean, this thing, and this autistic child is just standing beside there, sniffing in ADHD and autism. And then they say that they are going to speech therapists, they are going to physical therapists. Whereas they have damaged something already in the house. So you can see these ones are devoid of a lot of, this one, I use this propolis cream a lot because of cuts. You know, when a child has an injury, we're talking about chemicals being contraindicated in children. Then you now come and carry chemical and now come and put directly inside the child's blood when the child is having injury. Well done. So you need to put something like this that has powerful antimicrobial activity and has powerful somatic stem cell stimulants to heal that place quickly. We know that children being autistic can make them hyperactive sometimes due to the ADHD, and they have high tendency of getting injury. This also does this, a similar thing. It's a spray in a spray form. That's Aloe spray. This is the one that, yes, this is the one that is for the, that is used to substitute deodorants, usually in autistic children that are now becoming about to enter puberty. Usually the girls, they can use this, you know, to prevent the exposure to those aluminum compounds that also affect. This can be used to replace milk. That's a measurement in there. You know, so at this juncture, you can entertain questions, and I really appreciate our patience so far. So if you have any questions, all you need to do is just you can raise your hand, or you can type your question in the chat section, and I will definitely answer. So I really appreciate everybody. Thank you so much for your patience. I believe we spent about 40 minutes in this seminar, and we can use the remaining 5 to 10 minutes to answer questions. Thank you very much.